I'm not comfortable with that. Again, that's one of those conversations.
See,
I'm not comfortable with that. I've never done this before. Can we do one together? Can we do a couple together before I go anywhere?
See, at our work,
Is that?
Right, we're ready to go.
this,
Ready to roll.
they
Good morning,
really
ladies and gentlemen. Welcome to VFA School of Nursing. Shut up, you lot. Let's go. Okay. So, I'll just.
Sorry.
So let's start. What I want to go through is the Cluster 1 assessment tasks. Now, Lara went through last week Cluster 2, 3 and 4. Okay, and we will go through the whole system just so you see exactly what is being closed off in this placement. It's massive what is being, the components of the course that are being closed off with this. So Cluster 1 AT, that will all be finished by the time you finish placement. Assessment task 14. Okay, so assessment task 14, keynote here, will be done in class. Okay, will be done in class. The reason I'm showing it to you is that it is a role play based on scenarios that you will experience while you're on placement. So what I want you to do is be thinking of, oh yeah, I could do that on that scenario. Okay, if you've got this in the back of your mind that you will conduct a debrief with 3 of your colleagues, your fellow students, your assessor will observe the debriefing and assess you according to the following criteria. Once the role play is completed, provide a reflection of the communication process describing any complex situations and the communication strategies you used. So you will monitor and respond appropriately to changing group dynamics, clarify the purpose of the meeting and manage to get that whole thing of allocation and time management of your assigned allocation and what you've been asked to do. You will use a culturally appropriate approach in the provision of nursing care. You will work within legal and ethical parameters, including supporting rights and meeting duty of care requirements. You will perform within current scope of professional nursing practice. You will apply professional standards of practice in consultation and collaboration with a registered nurse. You will complete the relevant flowcharts and documentation. You will report and record concerns in the resident's condition or behaviour and situations of risk using appropriate health terminology. And you might be one who the nurse says, oh, they're always like that. It might be you. Don't be afraid to say, oh, I thought that wasn't normal. Can you explain why that's normal for them? Sometimes you might be the one to pick up something that's really different. Remember that with complex patients, there are abnormalities that are normal for those people. So it's a learning curve of what is normal for them and what is not normal and new and needs to be addressed. And this is just the beginning of that recognising as you go along, especially with all your assessment skills that you guys have learnt so well on. It may be that you're the one to pick something up or that you're the one to actually see a new, not normal. You will complete, done that, we will report and record progress of and care provided to allocated residents for use in handover. If you're given a chance for a handover, give it a go. Okay, you're not meant to be perfect at handover. Okay, you'll stutter through it, you'll miss it, you'll think, oh, what was that? Okay, and you'll see someone else do a handover that's really schmick. It's actually a skill you have to learn. Working at triage and emergency, I see the paramedicine students come through, and they all come through, and it's like the person they're working with say, "Go on, you do it." And I'll say to them, just give it a try. I'll ask you questions if you miss anything, but give it a go. And they'll have their notes and you do. Then you say, okay, because it's a skill. You don't remember everything, and we don't always get everything in handover. But if you get the opportunity, or if you can, grab the opportunity to hand over. Just so you get to practice it in a real scenario.
Sometimes I say to students, have a go, and they'll have a practice with me, but I'll say have a go, and if as you're stepping through your ISBAR, if I see you're about to move on to the next thing and I think you've forgotten something, I hope you don't mind if I interrupt. So sometimes you could probably give them permission as well to say, can I have a go? Like, do it the other way around. Can I have a go? And if I'm missing something, will you jump in and it won't put me off my sequence? Like, you'd sort of work together to do it.
Yeah. No one should expect you to be good
No.
at handover.
Yeah.
Okay, it is a learnt skill. So again,
Yeah.
it is hard. Being a learner is hard because you think, I'm a really intelligent person and I feel like a nuffy. You just have to swallow your pride there and say, no, I'm going to be a learner and I'm going to keep doing it because I'm going to get better at it. But yeah, give it a go. Follow safe work practices for direct person-centred care, manual handling and infection control to ensure your own health and safety and that of others in the work environment. Apparently the flu's hitting, so you might have someone who's slightly slacker at precautions. That's okay. You're allowed to say, I think I'll put a mask on for this situation. Okay, so again, don't be intimidated into dropping your assessment. If they can argue it really well why you shouldn't or should do something, that's fine. But if at all concerned, then you've got a right to protect yourself. Follow organisational done. Reflect on own practice in conjunction with supervisors. Actively seek and reflect on feedback from clients, supervisors and other relevant sources. On your one-day observational, the facilitators you had were pretty good. Yeah, that's the aim. Generally, the aim of facilitators, hopefully, is to be approachable, is to be helpful. If they're not that, then you'll just have to be really diplomatic. But
Preceptors.
it's using them.
Preceptors. Because they just had preceptors, didn't they?
Oh, did they? Okay.
Yeah, preceptors and we facilitated.
Okay, all right.
Yep, just
So
I get
just
confused about the
but
language.
use them in whatever way you can. Now we are going to go through as well, page 14, because these are the things you can do. Scope of practice, page 14. These are the things you can do. Sometimes you feel like you're a bit scared to say what you can't do. Know what you can do. Because if they say, oh, can you do that? No, but I can do this. All right? So you're not just saying, no, I can't do that. No, I can't do that. No, I can't do that. I can do it. I've never done it before. You know, I've only just practiced it in the lab, but I'm allowed to do it. Can I give it a go? Would you help me do it? So be proactive with that. So what can you do? Well, hand hygiene. Hopefully you'll be doing lots of that over the next 2 weeks. And again, just because the person you're working with doesn't do hand hygiene, stick with it. I know at work, I know my colleagues who do and who don't. I'm not going to tell them off, but it doesn't stop my practice. Okay, so your practice needs to be good, regardless of what others around are doing. But don't tell them they're not up to scratch. Bed making. Without patients in it.
That's what the hand hygiene auditing people are there for.
They come along and stand at the sinks and see who does it properly.
Correct.
So bed making, with or without the patients in it, you can do that. Again, I'll do that bed. Proactive goes down very well. Assisting the patient to ambulate, so you can all do that now. I've got to, she probably should do a bit of a walk this morning. I'll come with you. Can I take you for a walk while you do the medications? So there are lots of things you can do. Think of all the things you can do, not the things you can't. Assisting a patient with eating and drinking. Okay. Assisting the patient to maintain personal hygiene. So bed, bath or assisted shower, undressing, dressing, oral hygiene, eye and nasal care, shaving, hair and nail care. Shaving. Talia, if you haven't done it, you haven't done it, that's all right. I hadn't, and I can still remember the first bloke I shaved at 17.
Yeah.
And I said to him, I haven't done this before, I haven't needed to.
Can I just say, because this happened at our work, if someone tells you to shave, don't shave off their mo or their beard if they've already had it. Because before I left for maternity leave, I had a student and she goes, I said to her, can you just give him a shave? And I walked out the door and I come back in. Half
And
an
his
hour later,
30-year mo had gone.
This wife had never seen him without a mustache other than on her wedding day. And she walked in and bawled her eyes out because she had, this woman who was Muslim, had shaved everything. And then I'm like, I am so sorry, but I just expected her to know to shave just that area, not the whole mo and
There you
everything.
go, lesson learned. It's always good to learn
because
from
you'll
someone
look
else's
like
mistakes.
That's
Ask
the biggest excuse.
Ask them.
Again, you can have a guy who's not looking terribly awake and alert in the bed, but I bet if you say, how do you like to be shaved? Any difficult bits?
And they'll be like
Even us.
completely delirious, and they'll still make shaving faces like.
Yeah.
They'll still do that. It's automatic, okay? Again, guys, if you're not sure, it's like with showering. I've told you I can still remember my first shower, and that was when I was 17. Showering someone else, that was my 64-year-old Polish man who'd just come back from a nudist colony and wanted me to do everything for his all over tan. Okay? It is awkward. If you haven't done this, it's okay to feel awkward. It's okay to voice that, not in front of the patient, but to say to the nurse, I have never done this before. Can you do it with me? Oh, you'll be right. Well, can you give me guidelines? Can you come and help me get set up? Because I really do feel awkward, and I don't want to do this by myself. You are allowed to say that. Anyone with, and you can say, oh, well, and if they say, look, I can't, you've got to do this one, I'm going to call a facilitator then, okay? There's stuff that you push yourself with, and you feel a bit awkward. There's stuff that you feel really awkward, and you don't have to push yourself to that.
So all you guys that haven't done a shower before and you're worried about it, remember I told you in AT3 that there's that whole work plan that you need to pre-populate, and all you have to do is make some placement, goals. That could be a placement goal, and then you have to talk to the facilitator about how you'll achieve that goal. And that's all of that part of that AT for me done. And this is a perfect example of something you could put in there.
But once you get it,
And just to reassure you, most older people are quite awkward about it. There's one in a million who wants to flaunt themselves. The majority are quite private and feel more awkward about it than you do. Okay, so they might be used to it now because they've been washed and assisted for months and years, and they're just going to treat it as normal. But there's certainly like people are very normal and private, and just look at you as a nurse. You're just a nurse, and you're giving them a hand. And I will, like, for a woman, if I'm assisting someone in the shower, I will say, here's your washer, you wash down below. Like, I don't need to do that. You wash under your arms, you wash down below, I'll wash your back, I'll get down and do your legs because you can't reach those bit. But give yourself a go everywhere else. And that's part of maintaining independence. And that's just, I don't need to, if you've got a hand and can reach, you can wash yourself.
So these people are going to be like, not that.
Well, I don't know what they may be
some
full
people
care.
a lot of people at our work we have to because they're so adamant and demented.
Yeah.
They're not cognitive. Like
Yeah.
you can't.
So it
you have
depends.
to watch
It depends where you are
Yeah.
and who your patients are with. But it's possible you will have an assist shower.
They'll probably give you the easiest
not a
one.
full.
Yeah.
So if you've got someone who you've got to help with their walking frame into the shower and sit them on a chair because they can't do that by themselves, and then you get the hose out and you're giving them a shower. Look, I'll do your back. You do under your arms. You do your boobs and do your private bits, and I'll do your back, and I'll get down and do your legs because you can't reach your ankles. That's generally what I do with someone who's still able to, we want to maintain independence, so anything they can do, we're going to get them to do.
and normally what I do is with time management, I always make sure that I get their clothes out. If they've got a pad, face washes and towels, put them all in the bathroom first. Their shoes, everything, so that then when you take the resident in and give them a shower,
You don't have to leave.
everything's there and you're not running backwards and forwards and they're getting cold.
Yeah, good
Yeah.
point. So those and sometimes you learn those. Hopefully, if you remember that information, that's good. Otherwise, you learn by mistake because you leave them and then come back and, can you grab me this? I can't leave her.
And just don't
okay,
let them hold
but-
their toes. if they can't, because you end up having a shower with them.
And if it is someone who is so debilitated that they need a full wash, then they're not going to worry about what you're washing anyway. And it's very much just doing that care for a patient who can't do it for
But you would
themselves.
have someone with you. for
Yes,
that.
you should always. And that's what I'm saying.
They should be
you
able to
should
know how to
you
wash
should have you should be helping someone for the first week. So for the first week you should be helping someone, and then it might be a case of, well, by the last day there, you've helped me with Joan for the last 4 days. Are you happy to be in the shower with her today? Yeah, I can do her, because you know what to do. You know Joan, you know how she works, and you can sit and have a chat about her grandchildren while you're giving her a shower, okay? But if you don't feel comfortable about it, talk to your facilitator, okay? It's okay to feel a bit uncomfortable when we don't do that for people. It is something different. It's out of our normal everyday things that we do, yeah? So don't panic about it. I remember being very concerned up until my first shower, and I was the most naive person in the group, and I was the one who got the all over shower.
Nudist collar.
And I coped. I coped, and we survived. And after that, it was all downhill from there, really. But don't be afraid. Again, voice your concerns, and not with panic. But just say, look, I've never done this before. We're doing this together, right? Or I'll give you a hand. Oh yeah, I'll give you a hand with that bed bath. I'll give you a hand with that shower because I'm nice and I will help you. You will do most of the work, and I'll just be there as an assistant, especially for the first few times. Yeah. Assisting with elimination includes urinalysis, urine specimen collection, perineal care, ostomy care, and stool assessment. I was tempted to say you must all do a stool assessment before returning, but no, I won't do that to you. But certainly, all that toileting. Certainly, if you can do a dipstick, you might be the nurse to pick up a urinary tract infection. I just helped her to the toilet. I got a pad off, and it smells really awful. Should I do a dipstick? Can I somehow do a dipstick on this lady and see? Okay, remember those kind of things, especially in aged care. Patient comfort, pain management, non-pharmacological interventions. So think of all the things we've talked about. Yes, hot and cold packs, positioning, pillows, sitting up in the bed, doing whatever I can to make my patient more comfortable. So think about all those nursing interventions that we've drummed into you. Positioning of a dependent patient using a slide sheet. Mechanical lift. Hopefully you'll get to use the mechanical lift with a real patient in it. It's good experience. It's not the same as doing it downstairs. Again, I can help with a lift. Do you want me to give you a hand with a lift? I don't know this machine, but if you show me what to do, I'll give you a hand. Okay, it's that being proactive with something. Preventing and managing pressure injuries. Again, if it's a really busy place, you might be the one to say, should we go and turn a lady in 3 again, because it's probably been a couple of hours, and she had that, it was a bit red this morning.
When do you reckon's the best time to assess people's skin?
Shower.
Yep, 100%.
Got their clothes off. Range of motion exercises, and again, if you're bored and nothing's happening, then find a patient you can run through some range of motion exercises with. Pardon? Drop and give me 20. Only if you do it first, Mitchell. Documentation. Go for it with your documentation. Get used to the charts. Ask if you can do a set of obs and put it in their obs chart. If they've got them there, do the resident of the day, where they do an actual set of obs on them. So because they're long-term care, a lot of the clients you'll be looking after won't have regular obs done on them. If there's a patient of the day where they have their temperature, blood pressure, pulse, everything, can I do that? Can I do that and see who your patient is? Can I do a full assessment on you? Can I do a head-to-toe assessment on you? Go for it, as long as they say yes. Let the nurse know what you do. I think you guys have been quite well prepared with your head-to-toe assessment. I don't know that every student at this stage of their training comes out with that ability. If you can put that in as part of your practice, you guys will stand above the crowd. Okay?
100%.
It's a really good thing, and even there's registered nurses who aren't good at the head-to-toe assessment. So to be able to say, can I do patient of the day? After 3 or 4 days, once you're comfortable in the place, once you you'll get to know people by name. And it'll be, I like her, I showered her the other day. If she's resident of the day, can I do her obs and go and do a full assessment? And I'll come and show you.
Resident of the day.
So what they do is they just have one person every day who has a full set of obs done on them. Just as just a random. So they'll go through, which means every resident gets, every couple of months or every month gets a a set of obs done on them.
Because remember, it's their
Unless
home.
they're too.
Their nails cut.
Well, unless something changes.
No. We have resident of the day too, but if they're
Dying.
pretty much on death's door, then you
Yes.
don't have to do any of the.
Yeah, so obviously if someone is being
Make
palliated
decisions today.
Progress note.
and it's not going to make any difference. But if they're
Do something.
still okay, then it's that just making sure there's intermittent. Yeah. Clinical handover at a change of shift, go for it, try it. Yes, it's a challenge. Yes, you can sound awkward. Yes, you can miss stuff out. That is normal. Okay, but give it a go.
First time will feel like word vomit, and then it will feel less like word vomit.
Or it might feel like blank. I've just gone blank.
Yes,
Um,
and it's totally okay.
I'm a picture person, so I picture what did I do for that person this morning? You know, what did I see? Look, listen, feel. What did I see? What did I hear? What did I touch with that patient today? What did I assess in what I didn't and see them? What normal? Yep, this is all good. This is all good. This is as usual. This is as usual. She did complain of her back hurting more than normal. Okay. Admission, discharge, and transfer. Really key thing. You are going to placements where not a lot of change in residence. It's not a short stay ward at the hospital where you've got people coming in, day out, coming, going. Okay, there's not a lot of transfer of patients in, out. And some of the discharges don't always go somewhere else. They
No.
sometimes go God. So if you get wind of an admission coming in, hand up. Don't, fight in the corridor between yourselves. I'm doing this one, I'm doing this one. Let's do it together. Can we do it? You need to do an admission. Okay, it's in here in your placement logbook. So if you hear of an admission, you need to talk to the staff, talk to your facilitator. There's an admission coming in. It's on the other side. Can we do it? Can we do it, please? Because you need to be ticked up on that. If you don't get it done this time, then it actually transfers over to your next placement and we can't close off cluster 1. So you have, how we've done the kind of, we've tried.
Is it guaranteed that there's going to be a new admission?
No, it's the biggest issue with the Diploma of Nursing course.
Okay.
Okay, the biggest issue statewide with the Diploma of Nursing course is that you are required to do, that's why we did the simulated admission,
Yeah.
because you're required to do at least 2. Okay, and one has to
Let's
be.
hope someone dies while we're there, so then someone new person
Can
can
these
come in.
guys or personal care workers get one in when they're at work and have it signed
No.
off that way?
No.
It has to be because they're not working as a student enrolled nurse at work. You have to be in the context of a student nurse Diploma of Nursing. Yeah.
Everything else would just be that one thing. So
Yeah.
if there's one admission, there'll be like 10 of us there.
Well, that's it. And certainly, if you get to do an admission, don't you dare do 2 admissions if another one of your colleagues is on. So if there's another mission, and it might be a case of saying, can we do this together? Check with your facilitator and say, if we do this together, can we both, be marked off on it, especially if it's
Do
rare.
they know that we have to have admission?
Yeah.
Okay.
Yeah, and it's an ongoing issue,
Yeah.
but that's the kind of thing where you say on the first day to your buddy, by the way, any admissions, it's just a key thing. Lots of other things you will do. Admissions and discharges are hard to get in an aged care
Are
facility.
we're going to be paired up with an EN though, yeah?
Yeah, depending on who is, you
Because
could be
they would
paired up with an RN.
Could be an RN.
Oh, okay.
It'll be EN or RN that you'll be paired up with.
Because I know the ENs aren't really got anything to do with admissions or nothing.
But that's where that's what I'm saying, if you hear of one coming in, you say to your buddy, I need to just say I need to call the facilitator.
Yep.
If you hear of an admission coming in, then you say, or every morning, you can just annoy them every morning. By the way, any admissions today?
Yeah.
Just checking any admissions. Because once they know that you guys are all looking for admissions, there's an admission coming in this afternoon.
Yeah.
And you can just, fight each other for it.
Or transitional care. If you're in transitional care, you might get a discharge that's not going that way, that is actually going home.
Okay, so anything that is admission or discharge with paperwork, with the education, that kind of process, go for it. Okay, but be aware that's one we really, really want you to get, because then we can close off cluster 1. Otherwise,
At the end of the world.
It's not the end of the world.
we
no,
should
but it
find
just
out.
means all those units,
Yeah.
those 6 units, stay open until next placement. It means if something happened, like we'll go through it. But if
Take
you
your
get
credit
all
with
this signed off, then you've got 16 units complete out of a 25 unit course.
So we should try and find out early if we can buddy up to do admissions if admissions come in.
Definitely, and that's what I'm saying. If you
Grab another student,
Make a
go
note.
together.
Make
Yeah.
a note for it for orientation questions for the facilitator.
Alright.
and that's where I'm serious. Like if
Yeah.
you know, if you say it the right way and don't get too annoying, then saying to them, any admissions this week? Just checking, you know, like that kind of thing. Please let us know. Please let us know any admissions, just so they don't escape you. Because sometimes it's very easy to get so involved in your own work that you forget. Oh, that admission, you guys could have done that. Okay. So if they are constantly aware, then hopefully that.
I actually think Charisse may be going to going to sit in on some of the orientation on Monday, so she'll be there to help you. You know, ask questions.
And
Just-
she wrote this, so she knows.
She'll help to facilitate ask questions
Yeah.
with the facilitators.
Head to toe basic assessment you can do, and even though like you might have a patient who suddenly becomes unwell, or they're waiting for the doctor to come and assess because they're not right today, you know, you can say, can I do a head to toe assessment on them? I've been trained to. Can I do a neurological assessment? Can I do, you know, someone's fallen over and has got a skin tear on their leg? Can I do a neurovascular
And they don't.
assessment on them?
And you might, they might not know whether they hit their head, so you have to do
Yeah.
neuro ones anyway.
Jump in there and do it. If it's really critical, then you can say, is there anything I could do? Can I do a blood pressure? Can I get a BGL on the person who we've just found with a GCS of 8 in their bed? Can I do a BGL? Okay, that will be very impressive if A, you know to do that, and B, you go and get it done. Okay, that will be impressive. So use opportunities. This is what I can do, get in there. Temperature, pulse and respiration measurement, go for it. Blood pressure measurement, go for it. Pulse oximetry, go for it. Blood glucose, yeah, get used to it. And just get really confident in that. Neurological observation, neurovascular observation. And if you see someone who's got PVD, what's PVD? Peripheral vascular disease, remember? So they've got the real poor circulation to their legs, or they might have peripheral edema, okay, so the real swelling. When you see they're not normal, say to your buddy, can I do a neurovascular assessment on that patient? Go up to the patient, can I just check your feet? I just wanted to check your feet for your circulation and your nerves, is that okay?
See if I can feel a pulse.
Yeah, see if I can feel a pulse.
Okay.
Is it okay? Most people will say,
Dorsal
oh, yeah,
sinus.
sure, because they think they're getting some kind of treatment. They think they're getting, anytime I'm getting someone who's looking at me with interest to find out what's wrong is a good thing. So give it a go. If you see someone who has got neurodeficit, then without annoying people, but you know, see if you can find the not normals. See if you've got a COPD patient who you have got to know over the last few days, and you say, is it okay if I listen to your chest? So we're so used to the normal that we haven't had the opportunity to hear and feel and see not normal. So if you get the opportunity,
Yeah, listen to some chests.
then give it a go and see if you can hear the difference. Yeah. Pain assessment, 12-lead ECG monitoring. It may not be common, but you might be more up to date with the procedure of ECG monitoring than some of the staff you'll be working with. Okay, you will have done one more recently than some of them. So it might be you who says, "Oh, I can help you with that. I've learnt that in lab. I'm not great, but I've done a couple. Can we do it together?" Okay, and you've got your little. Most of them have got the little cheap picture somewhere that you can look at. Aseptic technique. Okay, see how you go with your aseptic technique. If there's any opportunity for that. Infection control. You may, especially if you end up having a flu outbreak where you are. Hopefully not.
Gastro.
Gown and glove. That's when you get a patient who's got gastro and they send a student in. Why not?
I'll be saying that.
And if you get to do basic life support, CPR, airway management, or use of an AED, then go to it.
Make sure they're for resuscitation.
You just make sure they're before you go putting the pads on, just check the NFR status. Okay? So just remember all the things you can do, not the things you can't do. Let's have a break, 15 minutes. I know that you know. So this is it here. Now we are closing off 1, 2, 3 and 4, which is, as you can see, well over half of your course. That's done. I just want to show you that to encourage you before I go through all the tasks that need to be done. Because there is a lot, but when you look at page after page after page and make your list of all the little things you need to do during placement, then know that it is to close off 16 units, which is massive. Okay, so let's go with it. We will come back. Yes. Hot or cold?
It's just stuck.
Windows open. Do you want? We want aircon on? We're going to come back and do objectives before we finish too.
Yes.
So
Pre-filling out.
let's go to part C, which is on page 17. And you will see that in part C, I have to do another one later. I'll come and grab you. Yeah. So in part C, you will look down and you see cluster 1, cluster 2, cluster 3, cluster 4, and below are all the individual units that you will be completing. So therefore, each one of those units has a checklist of requirements that have to be done in the clinical setting, okay? So a lot of stuff that you do in lab gets signed off, a lot of stuff that you do in class gets signed up, stuff we've done in tute gets signed off, but there are some things that have to be done in the clinical setting in order for you to be deemed competent or satisfactory. So that's why for each one of those units, there is a checklist, because we can't get by the government's request for those to be done. So when we go through one after the other, that's what it's all about. Conditions of assessment, I'll let you read that later, that's yours. And then we go on to page 20. Okay, so at the beginning of page 20 is your cluster 1 summary, which shows you the 6 units in cluster 1 and what is required of them. Yeah, so page 20. And you'll see up the top, HLT, AAP, 002. Obtained, correctly interpreted and used anatomical and physiological client information to check the physical health status of at least 3 different patients. Okay, so that's what you need to do for that unit. And then you'll see on the next page, which is page 21, there's the checklist. So the checklist for HLT, ENN, oh no, it's a different. We got them out of order. So apply communication skills in nursing practice on page 21 is that unit and the things that you need to do. So it's in blue because it's stuff you need to do. However, you do not tick yourself off for them. You don't do any ticking off or signing or circling. That is all done by your facilitator, your supervisor out there. Okay? But what you can do is alert them to the fact that I've done this, this, this and this today. Are you happy to tick me off on this? So that's why if you look through and see these, so have you identified indications for effective communication skills in a complex situation? Have you demonstrated respectful and empathetic communication in complex situations? Does the student communicate using effective communication techniques such as active and interviewing techniques? All sounds really complex. This is where, when your facilitator's coming round, you say to them, hey, I had a really good chat with a patient and her family this morning. My buddy will be able to tell you, can you sign me off on half that page for communication?
And don't
Yeah.
overthink the complex. Like Kath said, complex could be, I'm worried that my mum's not eating.
Or I'm worried that my mum's deteriorating. Is it possible to get the doctor to have a look at
Yep.
her? So you have a look at the patient, you have a talked with your buddy there, but you might be the person the son grabs because you're in a uniform, you look official, you look like you know what you're doing.
If you don't think to do that, would your buddy realise that some of these things like
No.
Okay.
So your facilitator, the person who's in charge of all of you, knows what's on here.
Yeah.
But the person you're working with,
That's no good.
if they do, that's really good.
Yeah.
But I mean, I know that they had to have things ticked off, but I had no idea what they were. So don't rely on them. You know, and that's where after the first couple of days, you look through and think, oh, hang on, I did that yesterday, or you know, next time I do that, I'm going to, you know, in front of the facilitator, say, can you tell her what I did this morning, please? Can you tell her that? And then the facilitator can go down and tick that off. But it's largely driven by you. You guys are responsible for getting this ticked off. And your facilitator will really appreciate it if you don't leave it all till the last Friday.
So we almost need to have a checklist of all of his stuff on us so that we are remembering.
Well, but I mean, guys, think about it. I don't want you to write every single one of those because there are other tasks. I mean, a good episode of communication will cover half that.
Yeah.
You know, and it might be your handover will show that you have adheres to legal requirements of documenting information about a person, that you have used medical terminology inappropriate in a verbal communication. So you do a good handover and you might be able to tick off half of that and then do some progress notes, you might be able to tick off the rest, as well as ticking off the tasks associated with this unit. Okay? So what you've got to write is, and if you want to write the unit, communication times, you know, AT 17 and times 4 episodes, because over the page, has it not got anything extra? Yeah, sorry, over the page is the extra. Okay, and over the page it says in page 22, okay, final performance outcome record for that unit on applied communication skills in nursing practice. It says this student has satisfactorily demonstrated on professional placement, communicates effectively within the context of the enrolled nurse in 4 different complex communication situations. Have you seen that somewhere else? In the AT 17, okay? So AT 17 talks about 4 different complex situations, yeah? So it's the same 4 situations. Use them for everything. Know that you've got to do 4 complex, make 1 a written, make 1 with a patient or a family member, make 1 with another health professional, okay? And have it in your mind, I've got 4 of those to do. And then you do that, you might have one day, you do it, write it up, get your facilitator to look at it. You know, it might be 5 minutes. I do a really good handover, and I talked to the patient's daughter this morning. So when we finished handover, can I have 15 minutes to write in my logbook? Yep, sure, okay. Write those 2 up. Okay, can you sign me off for those 2? And can you sign me off on that checklist? Because it relates to checklist on page 21. If you know that, bang, done.
So you write them up, and then when your facilitator comes by, you go right off.
Yeah.
All this stuff. Can you have
And
a
that's
look at
where,
that?
and you get used to it. You get to know who they are, and you give them a call and say, hey, I'm just aware of doing those, getting these done. I've done 2 lots of communication. Are you happy if can I grab my logbook and write them up? And then you can tip me off on that. And if you think ahead and get that organised, they will love you. Okay, because they don't want to arrive to Friday week and have, you know, however many logbooks to go through every single one of those pages and find and say, oh, did I see her do that? Did I see him? Oh, yeah, I guess so. Yep.
These are good questions to have for Monday orientation, to ask them how we're going to organise our access to the books. Are you going to keep them? How do you want us to document that? Do you want us to grab you? So they'll tell you how they want to organise
And
that.
depending on the facility you're at, it might be different for each facilitator. Yeah, okay. And that's where as long as, see, you're the key person here. If you know what you need to get done, and you write some notes and say to your buddy, can you sign it, that I've done it, then you show it to the facilitator the next day. I was working with Julie yesterday and she signed off on my written notes. Are you happy with this as my written notes? Oh, well done, yeah, great, okay, I'll talk to Julie later and just confirm it, but done, okay? Then we go on to the next, so 23 is HLTENN003, perform clinical assessment and contribute to nursing care plan. You've got a whole checklist that you can go through later, and then over the page, what are the final performance outcome record? What do you have to do for this? And it says, in the clinical setting, you have to safely perform nursing admission and discharge procedures for 2 different people from a healthcare facility according to workplace policies and procedures. Okay, that's your aim. That's the trickiest thing to get done in this whole placement. That will be the biggest challenge, and we just have to hope. We don't want lots of people to die, so lots of new people can come in, but we'll see how we go. But keep your eyes and ears open. If you hear of any admissions or discharges, grab it, okay? Next one, HLTENN004, again, your list there, have a look down, see what's required of you, know the kind of things on there, and again, over the page 26, implement, monitor and evaluate nursing care plans. Woohoo! Because we love nursing care plans. And again, your facility will have different care plans. They won't necessarily have what we've been using every place, have a different idea of a care plan. So look for what they have got and work with it, okay? Adjust it. What are you looking for? I'm looking for a problem that the patient has, interventions that as a nurse I can do for an improved outcome for my patient. And if you can get, that's what I'm looking for to be able to do and get signed off. Okay, that's good. So you've got students have satisfactorily demonstrated the implementation and monitoring of nursing care plans in the simulated environment. That's what you've done. And then in the workplace environment, implement and monitor at least 2 different nursing care plans in the workplace. Evaluated at least 1 nursing care plan in the workplace or in a simulated environment. So give it a go, okay? But at least 1 has to be done in the workplace environment. Yeah, are you getting the hang of it? Okay, so let's go on to the next one, HLTENN013, which is your implement and monitor care of the older person. Page 27. There's your checklist to have a look at. And then underneath, what will you have done as your final performance evidence outcome record? Analysed health information and clinical presentation of 2 older people to reach an accurate conclusion on possible nursing interventions related to their care in consultation with a registered nurse. Remember, your facilitators are all registered nurses, so if you're struggling to get one of the staff to do it, say to your facilitator, hey, I need to do those nursing care plans, are you free for half an hour? Can we have a look at the plans together and go through them? So you've performed nursing interventions and monitored nursing care for 1 older person with dementia, and perform nursing interventions and monitored nursing care for 1 older person with a physical disability. So again, that's got to be on your radar. I need a person with dementia that I have done 1 intervention for. I need a person with a disability that I've done 1 intervention for. Okay, intervention might be as simple as, you know, propping someone up with pillows, someone who's got a below knee amputation because of their diabetes needs to be positioned properly in the bed. That's a person with a disability, and you're monitoring their care and doing an intervention in order to
You'll find
help
them easy.
Yeah. So that's what I'm saying. If you've got all these things in your mind, then when it comes along, you think, yep, that's somewhere on my list, okay, to do.
It's where it'd be good to have your spare one that we've given you, because you know
You can jot down notes.
you
Yes,
can
yeah.
you can keep track of I've done that. You can readjust your time plan or your work plan to go, okay, I've got to try and capture that in the next week, or you know.
Or
Yeah.
you could jot down a little situation and then wait till you get your book and do about 4 situations at once.
That's it.
Yeah.
That's it. And and you can say, you know, you can get little sticky notes. Someone like Bianca will get coloured sticky notes, or Narelle will get coloured sticky notes, And the pink ones will all be communication, and the yellow ones will all be, and they'll be stuck up here. And so when she does a communication, she'll flick through and fill it in all those different places.
Don't worry.
I have it.
Some colours in.
I'm lost.
We all do it differently. Now then, on page 29.
Bianca's just saying she doesn't know where to start. So what do you reckon? Should this is where this spare sheet will be something that will help you to kind of plan what you're doing and what's been done while you haven't got your logbook.
Once we've gone through it, I think we're just going to give you some time to have a look through it here.
And then
So
ask
just
some
sit down
questions.
here. Even if you want to get lunch and over lunch, or you go out for lunch, come back and sit for half an hour, 45 minutes, and have a look through. Get your head around it, start making some notes, and then have a look before you go anywhere. Now you've got tomorrow as well to bring back questions, to bring back feedback, okay? So yes, we're throwing it out to you. Yes, it's massive. We realise it's massive. It's taken Lara and I quite a while to get our heads around it. So it's just been the fact that we've had to go over it and over it and over it and over it ourselves that we've got a hang of it. So that's what I'm saying. It's the kind of thing we'll give you time today just to sit down and look at it, even to talk about it together. Do you know where you're going? You can even divide up into your groups for the different places you're going and just sit. If someone learns by themselves, then they can sit by themselves and read it. If someone, is a talker, then find someone else who's a talker and talk through it. The kind of things you need to do. So we'll give you time to do that this afternoon.
Sorry to interrupt. Keep going.
No, that's all right. So on page 29, it's just another little activity. In consultation with a registered nurse, an enrolled nurse will be responsible for deciding on the right dose and timing of a PRN drug. Okay, PRN drug is when required. So an example of a PRN drug would be Panadol. Yeah, I got a bit of pain. Oh, what say we get you some Panadol? So here's another little situation. You probably should get her some extra Panadol because she's been a bit stiff and sore this morning. So you, in conjunction with your enrolled nurse or registered nurse, decide on what she should have. Have a look at the medication chart. Yep, she hasn't had it for how many hours? 4 to 6, usually 6 hours, yeah. Depends what dose she's on. How often can she have it? See what her dose is. When did she last have it? Yes, she can have it. So you've gone through that process of deciding, does she need 2 tablets? Does she need 1? Does she need something stronger? Okay? So it's just one of those decisions that you will make with the person you're working with. And when you've done that, hanging over their shoulder saying, yeah, that's a good idea. Okay? And you've gone through that process and you say, I need to be ticked off on that.
This is the framework that we've been teaching you. You'll assess the patient. The patient will say they've got a problem. You'll assess the patient. You'll do a pain assessment. And then you'll work out exactly what Kath said. So you're actually following sequences of things that we've taught you. And it's just going to go into a neat little...
And hope remember, they don't have to be complex. It doesn't have to be, I have to decide what dose of morphine to give. It can be as simple as they've got Panadol and Nurofen on the back of their chart here. Oh, well, let's start with Panadol. Why? Because it's our first line. That's a decision made. Yeah? So you don't have to complicate these. They can be simple things that you're doing. So don't feel like it has to be super complex. Number 2 on page 29. Describe a strategy you either developed or implemented to assist with companionship and social inclusion of a patient. Because this is all about the elderly, this unit. So that's when you said, they've got that meeting with the little group coming and singing in the whatever it is, the rec room this afternoon, and Joan looked all miserable and she's struggling to walk. Do we get her down there in a wheelchair? Done. You have just implemented the means to assist a patient with companionship and social interaction. Yeah?
There was a question in one of the cluster 3 ATs. I think a few people struggled with, how do you assess somebody's social and emotional well-being and what do you do about it? That.
So it's not rocket science. That's what I'm saying. Don't think these have to be really complex. It can be as simple as, we together with my nurse, we decided to get a bed-bound patient into a chair and down to the lounge room so they could hear the choral group that had come to sing. Yeah, that's so. When you do something like that and you've thought through this, you think, oh yeah, that fits in. What I've just done fits in. Where can what I've done fit in to a box in this book? If that fits in, write it in. Okay, that's what I did. I did an intervention there to help someone socialise.
And that might be a good way to do it, Bianca, rather than being all caught up with all of these tasks, is that you sit down and at a time in the day and you backtrack. What are all the micro complex things that I did in my day and where do they fit? Rather than looking at, like, I have to do all these things, do it maybe backwards, you know.
Yeah. So 3, reflect on a situation where you identified and responded to signs of distress or behaviours of concern with a patient unable to communicate their symptoms or concerns. What's a great example of something like that? Would be a dementia patient, someone who's a bit confused normally, who's, I don't want to go down to the dining room. Come on, let's go. Okay, what did you do? Describe the situation, 20 words. Okay, that's not, so describe the situation in 20 words. How did you respond? 20 words. Would you do anything differently? So it's just a really brief reflection. 4, describe how your own values, attitudes and beliefs towards ageing and the older person has changed due to your experiences on placement. 20 words. How has this influenced the way you perform your role? You might come back saying, I hate old people. Hopefully you don't. Hopefully you don't. Or they are nicer than I thought they would be and more fun. So lots of little thoughts and comments to be done along the way. During placement number 5, you will have gathered and analysed the health information and clinical presentation of a number of older people. Complete the following questions for 2 older people. Summarise their health information collected and clinical presentation, 40 words. What nursing intervention did you put in place in consultation with a registered nurse, 40 words. So that's 2 people, and there you go. What you've got to look for in that first week is 2 people.
Is that even like a handover, like remember what's about a condition?
Yeah, but you'll have opportunity. Remember, you're a student. You don't have to do that person's whole workload. You might get the opportunity to stay behind with Joan and help her with her meal. Okay? So you start chatting to her. When did you have your stroke? You know, and how's it been for you? And what did you do before then? What were the kind of activities? So you've interacted with this person. You know her a bit now. Okay? So you actually know her as a person. And so a lot of these things where it wants you to do almost a case study, then you say, can I have a look at Joan's history? So I can have a quick look at what she's come in with. Make some notes on Joan and Bob in the room next door. Make a few notes, what they come in for, age. We don't need details, so we don't want anyone to be identified on here, but you could say 86-year-old lady with a past history of a stroke, and she's got some heart disease, ischemic heart disease, has been in aged care for this long because it's not coping at home. You know, you wouldn't take much more than that to be 40 words. Yeah? So again, it's a bit of a snapshot that says I actually saw the person. You know, I saw a person, I actually looked at the whole person and saw who they were and have got that information. Yeah? Next one, page 32. Implement and monitor care of the older person. Now this is 4 pages worth, but a lot of them are tick boxes, okay? And a lot of them are incidences. So when you're talking to Joan while you're helping her with her meal, then you say to your buddy, hey, I'm in here helping Joan, da, 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 and then you go and say to your facilitator when they come round to visit, hey, I just helped a lady with had chat, come and meet her, I'll introduce you, because we're buddies now, we're friends. Are you able to tick off all this? And they'll go down and tick off that you had a positive interaction. You know, all those different bits and pieces. Does that make sense? I'm not going to go through them all because I think you need to just be able to spend some time looking through them individually. Then you go on to cluster 2. Okay, and cluster 2 is not as many units. Cluster 2 is 4 units. So you've got there, comply with infection prevention and control policies and procedures. Be aware of that one. If you ever have to put a gown and glove on because someone's got gastro, then you've probably almost done your whole tick list. You know, I put my hand hygiene on, I put my gown and glove on, I took it off. If you do that one day, then done, bang, let's tick off that. The same with implement and monitor infection prevention and control policy and procedures. Have a look through that. Let me have a look. One I do want to show you is page 39. This is getting into cluster 3. Apply legal and ethical parameters to nursing practice. Okay. Up the top it says, demonstrated through involvement in 2 specific documented situations in the workplace, the ability to work within the legal and ethical parameters that apply to professional nursing practice. Okay, because all you've got on the next page, on page 40, is just 2 boxes. It says students' self-evaluation and reflections of their involvement in 2 situations in the workplace. Now that can be with anything, okay? So when you think of legal things, it might be that someone has an advanced care plan, okay? So treatment is changed. It might be that someone has to do a consent for something. It might even be that they need a blood test taken or they need an ECG and you need to get a consent from them. Worst case scenario, and you haven't come up with anything else, see if you can do a set of obs and get a consent on someone, okay? Because you still need to get someone's consent to do their blood pressure. Yeah, you're not just going to walk in, grab an arm and whack a cuff on it. So look at the kind of legal implications, especially if there's anyone there who has got a not for resuscitation order.
Because then that then leads into asking consent, so the legal part, to do a blood pressure. And remember, you go into the aspects of ethics when you talk about autonomy, maleficence, non-maleficence and veracity. And they're all the things around do no harm, you know, maintain independence. So you're kind of, by just asking someone permission to do a set of obs, you're kind of addressing all of those parameters.
And when you've got a patient, and it's quite possible, you may not, but if you've got a patient who is in their last hours or days, and so we're not maybe giving their medications, okay? So we're withholding medications. That's part of your legal parameters. And it says, demonstrated through involvement in 2 specific documented situations in the work, the ability to work within the legal and ethical parameters. So all that means is, with my buddy, the registered nurse told us we weren't giving any more medications. So we didn't give this patient medications.
We consulted the drug chart and the doctors had ceased the orders, you know, so...
Or it might have been a verbal order and the nurse was ringing. You know, that kind of thing. How did I feel about it? 1 sentence. Okay, and what did I do? That was part of that working within legal and ethical boundaries. Yeah? Again, so that's 39 and 40. I'm going backwards, sorry.
So it'd probably be a good idea too, like, breaks or when you get home at night or whatever, to then go through the day and just jot it all down.
Yep. And even as you're going along, even if you're going, you'll have a notepad on you. Have a notepad and, you know, you don't have to put down names. If for your sake you want to put Jim up the top so you remember which one was Jim. Oh yeah, he was an old guy, tall, beard, who was going on about, you know, the war. Okay, 86-year-old, what did he have? Oh, he had COPD, and he had an ulcer on his leg that they were doing dressings on. So you do your little notes, and if you've done anything, you know, I was asked to do a BGL on Jim. Okay, did a BGL, chatted about his disease process or, you know, his shortness of breath today. Write a note on that, and then when you have time, look through and think, where does that fit in? 41, apply legal and ethical parameters to nursing. Demonstrated through involvement in 2 specific documented situations, the ability to work within. That's the same one, and that's your tick boxes there. Next subject, practice nursing within the Australian healthcare system. During at least one clinical work placement, you worked effectively in the context of professional nursing practice, including performing 5 different professional interactions to demonstrate adaptation to the nursing role and application of knowledge to nursing practice. All that means,
Is that cluster 3 or 4?
that's 3, oh is it?
Oh, is it? Is it 3? Just remember.
I think it's 3.
Yeah, when I went through that on Friday with both groups, we've just changed. You might see it differently on ED1 Go. We realised it had doubled up, so there's
So
5
this
interactions.
This is actually AT11.
Yeah.
So if you want to write up the top of page 42, it is actually assessment task 11 for cluster 3. So one and the same, all right?
You'll now see on ED1 Go, for you guys who might have gone and printed everything off, like I said, you'll now see on ED1 Go that it says, please refer to your placement handbook for this.
And you might that might be your interaction with the mother and daughter might fit into here. That you've put your nursing. I've learned about nursing education, and they wanted to know about nutrition. Okay, so you can put them all in together.
What 18 was it?
AT11 for cluster 3 is the table on page 43 and 44.
And do you remember when we went through it, I clicked it on ED1 Go and it was also up there. So it's not on ED1 Go anymore, it's just in your place. So you don't have to do 10. You get what I mean?
Cluster 4, up to cluster 4, we're nearly there. 3 units. Apply nursing practice in the primary healthcare setting. There's some things to do there. Is that it? Oh, and your other 2, Aboriginal health, that's all done.
In your 8.
And yeah, it's all
in the
done
place,
in
it's in
simulated.
ED1 Go.
So that,
There's a couple of tasks in ED1 Go that they know that they
Yeah.
have to do.
so that's it. What say we give you? Do you want to break into groups?